just perfectly. So,
Wow.
Yeah.
So it did work out perfectly.
Yeah,
for
it
you.
did. It did.
Unbelievable. What do you do when your patient suddenly cannot walk and neither can you because mentally you are done? Today I'm going to sit down with Dr. Rodger Pettigrew, one of the world's renowned veterinary neurologists. And we're going to try to tackle veterinary neurology, which is difficult in itself, but also his pathway to how he became a veterinary neurologist, which was not simple, and also figure out what he tells residents and interns and veterinary students about the profession when times get tough and what to look out for. Welcome to Irreplaceable Truths.
Hey, around we go, playing that game. Same move you've been done, they wanna stay. Hey, I stand on the edge of my...
Dr. Pettigrew, welcome to the show. How you doing?
I'm good. Good. Thanks.
Hey,
Glad to be here.
Yeah, man, your story is pretty remarkable. Because I can't wait for everyone to hear about it.
Okay.
Because you didn't start in veterinary medicine.
Nope, not at all.
I'll let you tell. I'll let you
Sure,
tell.
sure.
So
Originally, I went to UC Berkeley on I was a soccer player, so we were a bunch of my friends from the Nomads in La Jolla all got into Berkeley together. So there was like 4 or 5 of us. And so I originally was more interested in soccer and really didn't know what I wanted to do. And, around, I think, your sophomore year, you have to kind of figure out what you're going to major in. And I had all my units were mostly in political science, and I kind of enjoyed political science, so I figured I'd do that. So I majored in political science and then finished off my soccer career. I blew out my knee, I think in my junior year or sophomore year, and then kind of realized that soccer wasn't going to be my career. So I started looking other places and looking into different things I wanted to do, and kind of was looking at what I enjoyed. I knew I didn't want to work in an office. I didn't want to wear a suit, and it was looking into kind of thinking about biology, and then I realized that I couldn't finish my degree at Berkeley and transfer to a different major. So I took some classes there, finished my degree, got a degree in political science, and then I kind of was searching around like everybody does when they're, mid-20s and not really sure what they're going to do, and started working for a vet at just my general vet that took care of all our animals growing up. Wonderful guy, and started looking into veterinary medicine. And then, I was still not interested in veterinary medicine per se. I was kind of interested in, maybe I'll do, maybe I'll do animal behavior and then go back to school and get a PhD or something like that. In the meantime, I was also looking into oceanography and marine biology. I worked at the Scripps Institute for a summer.
Down in San Diego.
Yeah, down in San Diego, Scripps Institute of Oceanography, and just volunteered there. Hated it. So, and then a buddy of mine's dad, who was a marine biologist, said there's no jobs in marine biology, so don't go into marine biology. So, we're a buddy of mine whose dad was a vet and owned a clinic in San Diego. He was kind of going to go to vet school, and he kind of convinced me to apply to Ross University. And I'd applied to vet school earlier and got on the wait list at University of Illinois, and some other places. And then, but I realized I wasn't sure I was gonna get into vet school my second year, and I was getting older. So he convinced me to go to Ross University. So we flew down there, and at the time, Ross was this small little vet school it's in the Caribbean on St. Kitts British West Indies. And we flew in, and it was a gravel airstrip. There was maybe what looked to be a shack for the actual airport. So he and I looked at each other and we're like, okay, well, we thought maybe we had given them our deposit for the first semester, and we figured, okay, well, if there's really no vet school here, we'll spend a couple weeks here and then go home.
What year was this?
This was in...
Because
yeah.
it's a developing country. Some people
Yes.
say it still is because it gets nailed with hurricanes
Yes,
every year.
all the time. And we got nailed with a Cat 4 or something like that at the time we were there. And we were studying, I think, for 2 or 3 months without any power at all. No air conditioning, no lights. So it was brutal.
When was this?
This would have been, so I think 98, 90, yeah. So I went to vet school in 98, and then, so it would have been 98, 99, something like that. And then I graduated at Ross in 2000. So, and then at the time I still was like, I still kind of want to go into maybe animal behavior. So I was going to be an ethologist. I was going to go study, I don't know, African dogs or something like that. I really want to do something like that. And then
Where'd you do your rotation?
my rotation was at Oklahoma State. So big difference. So coming from the Caribbean.
Go Pokes!
I loved it. Everybody was just amazing there. People were incredible. School was great. Big, large animal school, and but just wonderful people. Loved it. And then it was there. So I graduated then. So I think it was in 2000. And then I still didn't know what I needed. And at the time, Ross University, you needed to still do a clinical proficiency test or another clinical year. So I decided, well, I think the test was expensive and you weren't positive that you're going to pass, so you may have to pay for a whole nother test. So I looked into schools for another clinical year. And at the time, I was also kind of interested in exotics, so Louisiana State seemed really great. A lot of my friends from Ross were going there and doing their clinical year, so I went to Louisiana State. There, I met some great people. One was a surgeon who was a resident, and he kind of convinced me, gave me the surgery bug. So then I realized I had to go back to. I'd have to get an internship, and so I applied for an internship, and went to Animal Specialty Group up in LA.
So what was the time where you're like, you know what? You said you got a little bit of the surgery bug.
Yeah.
When did neurology become
okay.
Okay, this is what I'm going to do? Because neurology in itself is a very, very intimidating specialty.
Yes.
And I remember first term at Illinois, we had a whole semester on neuroanatomy.
Yeah.
And I hated it.
Yeah.
Because you learn
everybody's
pathways
yes.
and all those things.
Yep.
So what did it for you? Because obviously it wasn't at Ross.
No, it wasn't at Ross.
It wasn't at
I
Oklahoma
had the
State.
same. I did well at the same. I did well in the neuroanatomy, but not even really that interested at all. And then, so surgery it was very difficult to get a surgery residency at the time. And so, everybody was applying for, and coming from Ross, it's difficult as well because, for one, it's who you know. But
I argue that the veterinarians coming out of Ross knew more their clinical year than we did in vet school.
Yeah. I thought it was a wonderful education, and I felt very confident. But again, it's still who you know. Most of the kids coming in the universities nowadays, they know the professors. They're doing research projects. They're getting they get to know the people that are going to be deciding who gets the residencies and internships and things like that. So we didn't have that and so it was harder. And so when I went to my internship and I kind of started getting interested in surgery, and and we applied for surgical residency, both Dr. Gassel and myself, because we were interns together. We both didn't get our residencies, so we applied. He got a surgical internship at Animal Specialty Group, and I went off to New York and did a surgical AMC, yeah, or not MC, sorry, it was Lives, Long Island Vet Specialty Hospital, sorry, but they were actually a lot of the surgeon that owned that. All of them went to AMC, so it was a big AMC connection there.
Yeah, because obviously with all my research I'm doing, a lot of these veterinarians I feel are early career vets are in this fast lane. Like they feel like they need to know what they want to do immediately, and that can really come back and bite them in the butt. Right?
Yeah.
What advice can you give these early career vets that, like, hey, take your time, choose your path, so you actually really enjoy what you're doing?
So for me, it was real. Well, one, I think one door closed and another door opened. So I did my surgical internship and loved it. Still wanted to do a residency at the time, and it was just I didn't get a residency for surgery, and I was like, well, what do I need to do? And the next logical thing was there was an opening for a neurology internship at University of Georgia, and it's all the people who you meet. So that was a great year. I met some amazing. There was a neurologist, Mark Kent, who was my mentor, and he was actually finishing his residency. He hadn't finished his neurology residency, and it was a small department at University of Georgia. We would have an MRI. Back then, you would get a truck come in like once a week, and we'd front load all the MRIs. We'd be doing 12 MRIs a day on occasion. Like that. I think that was the most we did at one time. So we'd start at 8 and be done at midnight. Did
all 12 of those MRIs go into surgery?
No.
Or no?
No. At the time,
they went to sleep. You figured it out. That you woke them up, and then you talked to the clients.
Well, we had one case, I think, that we went directly into surgery, and that was a cat with a brain tumor who was herniating. So we ended up going right into surgery then. But most of the time we waited, and then the next day we would cut. So
you actually did brain surgery on a cat?
Yeah.
And how was that outcome on the cat?
Cat did great. It was a meningioma, which cats, they're very superficial tumors, so they often, the thing is they just pop out and roll on the floor. So very easy to remove. But again, any brain surgery is going to be dangerous, whenever the air hits the brain, it's never good. So, but yeah, he did really well. And then I think after that, I still wanted to do a surgical residency, and I got to know all the surgeons at Georgia and I did rotations with them, and I thought, oh, this is great. I'm gonna get this surgery residency. And it turned out that when I applied, so what happens is there's some backdoor negotiations that kind of happen, and what had happened is the intern at Georgia, the general internship at Georgia, and the general intern at, I think it was University of Florida at the time, they just decided to swap the two, and there was some backdoor deal going on, and so I didn't get the residency. Took a year off.
So there's a lot of politics going into internships,
everything,
surgical internships, residencies, which I think a lot of these early career vets need to know.
Yeah,
it's not just your grades.
No,
right?
No,
it's who you know, what's your network.
Yes.
Are you able to, if you get called in for an interview, are you able to show a different side of just a smart veterinarian?
Yeah. Well, everybody has the grades. Everybody has the research that they do, and everybody's top notch who's applying for these residencies. So you somehow have to put yourself, show yourself above everybody else, and it's for me I think it was the right place at the right time. So I didn't get my residency. I took a year off. I had a hip replacement done. I did some research at Diane Shelton's lab at UCSD. She's a neuromuscular pathologist, and she had some research I could do, which I needed. I thought it would be helpful. And then I worked with some neurologists here. And when I was applying, so I hadn't decided if I was going to do neurology. And I called up my mentor, Mark Kent, and I said, I'm really looking into maybe doing neurology now. And he said, yeah, go for it. You should. And it was interesting. It had everything I wanted. I loved surgery. After my neurology internship, I loved imaging. I loved interpreting MRIs. I loved the fact that you can go do a neuro exam on a dog, localize the lesion, do the MRI, find what is causing this, and then, especially with like spinal cases, go in, take the disc out, and there's that immediacy. And so just the combination of all those things made me start realizing that this is what I really truly wanted to do.
Yeah, with what you just said, I have so many questions. So many questions. Wow. So, first off, let me keep it very general, because I always talk about, your professional identity.
Yeah.
How do you personally walk around knowing that being a veterinary neurologist is only part of your veterinary career or who you are? You don't walk around all the time just saying, "Oh, I'm just a veterinary neurologist." How do you incorporate that into your personal life?
I guess I don't really incorporate it. I guess I have somewhat of a separate persona at work than at home. People find out that I'm a veterinarian. It's not even that I'm a veterinary neurologist. They just find out I'm a veterinarian. They're constantly peppering me with questions and what do I do in this case, and then they find out I'm a veterinary neurologist, and they're like, well, most of the time it's, what is that? They're a veterinary neurologist, and I go, yeah, this is what we do. But I don't know. I think it's just I don't know. I guess I can't really answer that question. I don't know if it really, other than when they find out I'm a veterinarian, it's not really part of my everyday thing. I'm a father, so I have, 2 young girls that I'm taking care of, and that's kind of, and they come to work every once in a while and they see what I do, but they're not that interested in it at this point.
Well, wait, just wait. Wait till they find out that their dad's a brain surgeon, because that's a whole different level. Like,
Sure,
I hold veterinary neurologist because, I'm not the smartest, but I'm not stupid. And still, veterinary neurology to me is such an amazing science, because you are dealing with the brain. You're dealing with the neurosystem. You're dealing with something that really cannot heal that well once it's damaged. And so to me, my hat goes off to you, because that is such a difficult position. And the other thing is that most of the veterinary neurologists I met through my education in my early years were absolutely freaking crazy. There's one specific one that was the neurology professor when I was at Illinois.
Yeah.
And the two of us did not hit it off. They hated me. Like, if there was some way that she could get me kicked out, she would have tried to find it, especially senior year, because I started asking questions and asking questions and asking questions, and she couldn't stand me. But I won't mention names at all, because I'm not into that. So let's talk about the medicine really quick.
Yeah, sure.
Because I haven't done this with another guest.
Got it.
But because I'm so enthused about veterinary neurology, what is the one thing that you wish GPs would notice sooner than they do?
I would say probably when they should send a dog that they suspect has a spinal problem. Because, it is difficult when we catch dogs that are paralyzed and don't have pain perception, and we have to inform the clients that, you know, the probability that your dog's going to walk in is low, and that potentially, you know, we could have done something sooner, and maybe saved his ability to walk. And so I think that's probably the biggest thing.
Does that ever come back to hurt the general practitioner?
No,
Because, you know, obviously we're always worried about,
Sure.
you
Yeah.
know, the, you
Yeah,
know,
yeah.
the mental capacity of these GPs.
Yeah.
And, you know, I've had specialists like yell at me because it was a small 1.5-year-old white miniature poodle,
Mm-hmm.
severe pain in the hip. I'm like, took an x-ray. I'm like, this looks like leg perthes.
Oh yeah, yeah.
So did an FHO, dog did great. They went to go see the surgeon though because it had luxating patella, and she basically told the client that she couldn't believe I didn't get a second opinion on the histopath I sent out. And that was when I was like, what are we trying to prove here?
Mhm.
Like,
Yeah.
you know, you are smarter than me, but if a histopathologist tells me it's like perthes, then it's not
what it is.
osteosarcoma.
Yeah, exactly. Yeah.
Right?
Yeah.
So if you have that conversation with an owner, like, oh, if you would have gotten here sooner.
So I would have to say that a majority of the time it's more the clients, not and maybe cost. You know, they're looking at, okay, well, what is it going to cost to do, you know, and I think, and I completely understand that medical options are much cheaper, and sometimes they can do fine. But if in the situation where you're not really sure, and I think most veterinarians are very open with the clients, say as soon as if this is not working and you see your dog going down and getting worse and worse, you need to go see a neurologist. And so when they come in, they say, well, you know, my veterinarian said that, you know, medical therapy could work. He's right, and they're right. And I say, yes, it could. But in this case, your dog was getting worse and worse and worse. And, you know, you needed to bring in that your dog as soon as possible, as soon as you noticed that it wasn't working to begin with. So I don't think blaming veterinarians or general veterinarians for these cases is a good thing. I think if you give them that option, which I think most do, go see a neurologist. This is a neurological problem. Go see a neurologist. It's the clients that are deciding not to do it. And it could be cost. It could be a lot of different reasons.
Well, what I loved about you and your partner is that most people think, okay, if I send my case to a neurologist, they're going to do an MRI immediately.
Yeah.
And you guys wouldn't.
Not necessarily, yeah.
Right?
Yeah.
What are your tricks to localizing a lesion that you can give people?
So just the general population, the clients, the owners, I think if they start seeing their dog dragging the limbs, if they're scuffing
The nails.
the nails, sorry, and if they're you know, crossing over, acting like the dog is drunk, walking, you know, in an abnormal, not in a straight line. I think that's probably, you know, a good sign that there's something going on neurologically. Again, it depends a lot on where the problem is. You know, certainly, you know, if we're now moving up to the brain, you know, seizures, getting stuck in corners, vision loss, circling, head tilts, things like that, all are considered neurological.
Right.
So.
Well, just so I don't know if you remember this, but when I was practicing, I think you went 5 for 5 on brain tumors on mine. I stopped. I was like, I remember telling you on the phone, I'm like, I am going to stop sending cases to you because you give me things that
Yeah.
we can't do anything about.
Yeah, I know.
You
I
know? And I think it's really important. Then the next question is when to refer. Like,
Yeah.
how soon should I refer a case? As soon as I see that problem or a disc on an x-ray, or should I try medicine first and then send to you? What would you prefer?
I'd prefer giving that option immediately, saying this is neurological. If you think it's a neurological case, send it, because at least if we look, and again, like you said, we don't always recommend an MRI, but at least we can have that discussion with the client. They can be prepared for what potentially could happen, the cost of that, and then they can, make their own decisions. And then, sometimes we try medical management, and it depends on age of the dog, and we look at a lot of different factors before we make those decisions.
Exactly, age of the dog.
Yes.
Age of the dog comes into play.
Yes.
Age of the dog, I think, is more important, at least from my standpoint as a veterinarian, than cost of care.
Yeah.
But there are people, and the red flag is, this is my fur baby. It is.
Yes,
then
exactly.
If a client says this is their fur baby, it should be referred like the second it gets through the door. But and then the thing is, like, at least I don't want to say the pressure's off me as a GP.
Yeah.
But it at least is going to give them the full education of.
Yeah.
This is what's going on. This is how much it's going to cost,
Yeah.
and they can prepare for it.
Yes, exactly.
How much has a recent cost of care come in the way of you treating?
It has, and I think, there are definitely patients that I think I could have helped that, clients said they just couldn't afford it. And, in those cases, we try the medical management, and we hope that, that they will retain some function and have a good quality of life. And then, but I think it definitely, the cost of veterinary care has definitely made our job a little bit more difficult. Yeah.
Well, it's definitely not making it easier.
No.
And especially from what you just said, you knew you could help that animal.
Yeah. Yeah.
And so how do you deal with that personally?
So, usually when, again, there are different, we offer different financial, like, care credit and some other things that we can offer. And then there are some rescue groups. So we try to do everything possible so that they can try and be able to afford, the procedure. But we also want to be honest with them and, like, let them know that, again, if this is going to severely interfere with your financial situation, then there's always that, we can always try medical management, and if that quality of life doesn't improve, then euthanasia. So and that's a conversation we have all the time, and that's unfortunate, but in some cases that's the best option. So
does it ever get to the point where you ever thought, I can't do this because the cost of care is keeping me from doing what I'm trained to do?
No, I don't think so. I love what I do. I think if to go back and to say, I love the people that I work with and the clients themselves. I mean, it can be difficult, some clients, but most of them are. I have some great relationships with them, and to be able to help them out even in the situations which aren't the best situations, which can be they can't afford it. If you're there and you can help them through that situation, and they can make the best decision possible for them and for their animal and for their pet, it makes me feel good. And so, even in those cases where I think I could have helped them, I help them emotionally. I help them, just with the education and the support. Yeah. So.
Do you think your political science background helped you with the emotional intelligence, how to read the room and communicate better with them?
No. I think that's something you're born with, in a way. I don't know. I think.
See,
some people,
I argue with you. I think you could be trained.
Well, yeah, I
You
think
know,
you can
and
be
I
trained,
think I think a lot of the times, veterinary school does a phenomenal job preparing you for
Oh,
the
yeah.
technical
Oh,
aspect.
yeah. Yes, for sure.
So, how did you learn when you have a very emotional client
Yeah.
and a very risky procedure?
Mm-hmm.
How do you balance that conversation?
I think you need to be honest with them about, you know, and well, you need to set their expectations, right? You let them know that, these are the possible risks. This is something, that I do hundreds and hundreds of these, type of procedures a year, and and so it's trying to make them feel confident in you and confident in their decision, and then also let but yeah, be honest with them. I think that's I think it's the best answer I can give you is just being completely honest with them about what's happening and what procedures we're going to do and what those risks and benefits are going to be.
So do you always honestly feel like you're able to give them your deep emotions and true emotions and not just be on the surface acting like you care?
Oh, I don't get being emotional, and again, it depends on the situation. I've definitely been emotional regarding some of the patients I've had, for sure, and then it is, but I think you also have to be you have to set yourself apart from the situation that you're in, and the emotional dynamic that you're in, and think logically, and make sure that the client has confidence in you as well. I think showing emotion, certainly in certain situations, is I think a good thing, and I think it's helpful to the clients. But most of the time, I think you need to be somewhat stoic and be the logical one in the room, and you definitely show compassion, but you can't be crying at every euthanasia. I mean, you can't be. You just can't do that, and that would be incredibly emotional for you, and it'd be, I think most veterinarians, it would be impossible if you were crying at every, and that emotionally attached to every patient. So there has to be somewhat of a professional detachment. But there are those cases that you can't. It's a client you've had for a long time, or you put a lot of effort into trying to help the animal out, and something just doesn't go your way, and it's hard.
Yeah, and I think that's a big difference between general practice and specialty.
Oh, yeah,
right?
without a doubt.
Because, like, for me, it got so bad that August before I retired that I would go outside and vomit before every euthanasia.
Oh.
But I also think it was because I got rid of the entrepreneur hat, and I got rid of the manager hat, and I got rid of, so I was just doctor.
Yeah.
Right? And you don't realize the amount of emotional demands that this profession can have. And I don't think anyone truly prepares people for that in school.
No.
I think it all comes down to, like you did and like I did, and a lot of these people that love the profession, they spent a lot of time in a veterinary clinic knowing what they're getting into.
Yeah.
You're also were able to do the internship and the surgical internship, and then go work in a neuromuscular lab, and you got it all. And also you saw the bullshit behind all the politics behind this profession that a lot of people don't know truly exist. And it totally prepares you for it.
Yeah.
It does.
Yeah.
Can you tell what was your hardest case that you remember?
Oh my gosh. So I had a young Bernese mountain dog. It was not Bernese, it was a Swiss mountain dog. Fractured his back. And the clients were, I think both of them were doctors, so kind of knew the situation. The dog had some voluntary movement, so he was a good case, good candidate. He actually didn't fracture. I think he subluxated, and I think there was definitely a little bit of a fracture as well, but it needed to be stabilized. And so I went in and I did spinal surgery and stabilized with a plate. And everything went great, great alignment. Dog was doing fantastic. And about 2 or 3 days later, we were trying to get him up to kind of get him to walk. And I think either he slipped or he did something, and the stabilization broke down. And so we noticed that he was acting more painful, so something was wrong. So we re-imaged, or no, we didn't image. We just, we did an X-ray, and I could see that it had luxated again. So I had the conversation with them, and I said, well, this is going to be hard. I have to go in and do it again and see if we can plate this dog again. And then we went back in, and then I was able to kind of, salvage some of it and try to replace it, but it didn't hold. And about 2 days after, he subluxated again. And then I had to tell clients, because there's no bone left, and that, you can't have a dog that has an unstable spine. You can't survive. So they
Not a greater Swiss Mountain dog, 140 pounds
exactly
of muscle.
Yeah. And so that one, the clients were great, understood, and but that hit me hard. I have a picture of her, Penelope, on my desk, and it's just kind of a reminder. And to this day, I'm constantly questioning myself. Was it the stabilization? We didn't MR this dog because, and I kind of am a little bit, I told them that I was a little bit, hesitant to go back in and without an MRI, because, I wasn't sure. The dog was like 3 years old and supposedly fell off a small couch and subluxated its spine. So I was wondering if there was some pathology underlying all this. And so that's one of the cases that I don't have any regrets. I think we did everything we possibly could. Maybe it would have been nice if maybe the MRI would have picked up something that I didn't, notice in surgery. So that was the one disappointment, I would say.
And it's amazing.
And I have a lot of them.
Yeah. How many cases you have? You still always have that one.
Yes. Yeah.
Or two
that
are always in your brain.
Yeah.
So how do you rebuild your confidence after a case like that?
Well, actually, one of my mentor, the Mark Kent, the mentor from University of Georgia, once told me that, and I think I was doing a AA Lux stabilization. Oof. And this was in my residency. And my residency was interesting because I had two mentors. One of them left, and so I only had one mentor. So in my senior year, I was the only resident. In my senior year, my residency, they had to put me on clinics alone. And I remember having this AA Lux came in, and my mentor was gone. I'd assisted like a couple of them, and it's complex surgery. And I remember calling up my mentor, and he said, "Well, you're the only one there. Nobody else can do this. You've studied, you've seen a bunch of surgery. You're the only one there." So I don't know. I mean, you look back on it and you just say, well, you've been trained. There are things that are gonna happen that you have no control over, and you just gotta, you're the only one. You're the most, you're the most trained person to do this. in the hospital at this point, you got to do it. And you just suck it up and you do it. So it's
How
hard.
did it turn out?
Turned out well. The dog didn't recover as quickly as I was hoping, but it recovered back to walking again. After that, when I came back to, that was my residency, my first AA Lux, I think, on my own. And then when I went to SoCal with Dr. Barry, he showed me, he's like, that stabilization I remember, because we had a bunch of screws, and it was tiny dogs, like, I think it was maybe a, I don't know, 10-pound Chihuahua. And I remember having all these screws and cement and, placed it on this and just a lot of stuff. And when I came and started working with Dr. Barry, I went into one of his AA Luxes, and he's like, all you really have to do is just transarticular pins and cement. Why are you putting all this stuff on there? These are tiny dogs. You don't need to put all this hardware in there. This is all you really need. And so, that was, when he showed me that, and I was like, well, takes a lot out of it. It's still, nerve-wracking to put transarticular pins in, but, right along the spinal cord, but it made sense. And that's was great when he taught me that.
Well, you've been very blessed because you had Dr. Kent, you had Dr. Barry, you
Yeah.
had amazing mentors,
Yes,
right?
I did. Yep.
What advice could you give to these early career vets who believe they're not getting the mentoring that they need? Because that's the main reason
Yeah.
that they leave their job and
Oh, yeah.
ultimately leave the profession, because they just have so much self-doubt because they were never taught correctly.
Yeah.
What could you tell them?
Yeah. Find somebody. Anybody. Look. You can always leave that job and go find somebody and interview them, interview that doctor, and be honest with them and say, I need a mentor. If you're not going to, be there for me and teach me what you know, there's no reason I'm not going to take that job. So, I think if you have to, quit a job just because you're not comfortable there, because that's the worst situation where if you're thrown into a situation where you're just coming out of vet school and the mentor has put you in charge of the hospital and he's left, and that situation shouldn't happen. That should not happen, and you should leave. You should find someone who's willing to help you out and willing to be there. And I think an interview is as much you interviewing the veterinarian that you're going to be working for, as well as them interviewing you. And so I think getting that connection with the person, trusting them, and making sure they're gonna be there for you. That's all I can say.
Well, you work at a multi-doctor practice
Yes,
now.
I do.
In all honesty, how many of those doctors truly want a mentor?
Good question. So we, our facility, actually we do teach. We have a lot of vet students that come in through Western. So there are, and I would say a majority of those are interested in teaching. Again, it's maybe a little different than mentoring, but they are. I'm constantly talking to the vet students when they come through neurology rotation about, if they're interested in residencies, what to do, and internships and jobs, and so I do talk to them specifically about that. So I would say a majority of ours. I think some of the older doctors aren't as interested. I mean, but even Dr. Barry would say Wayne would be, I can recall he doesn't have students anymore, but a couple of my students have talked to him, and he'll teach them when I'm gone or something like that. He'll do that. So I think a good amount of them are interested. I think what happened with our internship is the goals of our internship for the doctors were not meshing with the goals of the students coming out of vet school and coming out of Western at the time. And so it, a lot of these, they weren't committed, they weren't, really, we were hoping to train veterinarians who wanted to maybe go, into residencies and do specialty practice. But, it just seemed like the type of students that were coming out and the type of students that we were getting were not, on par with what we wanted to teach. So,
do you think the values have changed of veterinarians? Because I remember when I graduated, my values were like family and integrity and stuff like that. Nowadays, I think it's work-life balance.
Yeah, no, definitely, without a doubt.
If your number one value is work-life balance, internships will be very hard. I mean, starting your career will be very hard.
Yeah.
How do you explain to new students now, the fourth years that come through, that this is how you should do it now compared to when you and I graduated?
Wow. I think, I'm honest with them about the time and the commitment that it takes to be a good veterinarian, and that you're not, yes, you want to, I understand you want to maintain that work-life balance, but you're in a profession which your responsibilities are in large part to the clients and the animals that they bring to you. And I guess I just say you're probably in the wrong profession, because this takes a lot of commitment, a lot of both emotionally and time-wise. And I'm sure it's affected you and your family life. It's affected my family life in that, it's just, there's less time I'm spending with my daughters, and but I just tell them it's to be a good veterinarian. I think you need to sacrifice some things, and I think that's some of the things you have to do. And I think we have definitely seen some of the veterinarians coming out that they just want to, couple days work in and then a 4-day weekend or something like that. Even the residents coming out nowadays, I think, who are are coming out and doing surgery and things like that. They want a 3-day work week or a 4-day work week, which I think it's unrealistic.
Yeah, especially for residency, right?
Yeah. Oh yeah. Yeah.
Residencies, internships, they're hardcore. They are hardcore. I just talked to a veterinary student who just graduated last week from Georgia. He's going to from actually Wisconsin, going to Georgia for residency.
Yeah.
And he's also an ultra marathon runner.
Oh.
And I asked him, I go, okay, how are you going to do this? I go, it's one thing to do it while you're doing vet school because you get time management. You can figure it out. During your internships and your residencies, did time management mean anything to you?
No, I was especially during my internship. We had 1 day off a week, I think, 24 hours, something like that. It kind of depend on what rotation you were on. But yeah, you were there early, you were there late. You didn't have a life. I was lucky if I got to go to the gym once a week or something like that. I mean, I tried to have the balance, but you're just gonna expect that year is kind of going to be a loss, and you just hope and that's not going to be your whole life. You're just trying to learn as much as you can in that year. My residency was a little bit easier. You're more structured. You're only in one certain department, so it was a little bit easier. It gave a little bit more time. But my surgical internship was crazy. Like I remember, it was brutal. We had, 40 patients in the hospital. We had to soap in the mornings and then call all the clients. And then we were also seeing, so we had to get that done. And then we had cases to see on the weekends. And then we were cutting that afternoon. So it was, I don't remember there was a month that it was in the winter in Long Island that I didn't have any heating oil. I lived in an apartment that, they're still supplying heating oil, and the landlord forgot to call in the person to fill the whatever, to replace the heating oil or whatever. I didn't know that. It was a month in the middle of winter, and I didn't know that. Like I was waking up, and there was like,
You could see
you see
your
my
breath.
breath in the morning. I was like, but it didn't matter because I was like, okay, I just, as long as there was warm water, I'd go and, I'd take a shower but I'd be at work the rest of the time. So I didn't even know until, I don't think it was a month, probably a couple of weeks, but it was middle of winter. So yeah, you don't have that time. So
A lot of early career vets think that the pressure's going to go away once you're experienced.
yeah,
Is that true?
I think you see so much. I think what ends up happening is the pressure's not gone, but you feel more confident in your decisions, and your decisions are quicker. And so, although there's always that, question, did I make the right decision? And certainly, like for instance, when we were during COVID, and we didn't have a lot of emergency doctors. A lot of the specialists did some emergency shifts, and I remember, I'm out of my element here. I'm not feeling really comfortable here. So yeah, that brought back a lot of that like uncertainty. But it does, as you see more, you get more confident. You can make the the fast decisions, the right decisions. So
Yeah, because there was a point, and when do you think it came for you where your conscious thinking became subconscious decision making?
I don't know. It just happened. Maybe, I don't know, a couple of years after my residency, I think, potentially. When you come out of your
So that was the thing, though. You did internships.
You're right. Yeah, that is true. That is true. Yes.
Yeah. So I mean, you got a lot of training.
Yeah, I don't know. I mean, yeah, I saw a lot. I did a lot. I've been to a lot of different places, and I don't know. I think somewhere in that, and it just clicks, and you start, the knowledge that you, all the book knowledge, it starts coalescing, and you start realizing that these, and the important things come back, like the things that you're going to see a lot of.
White feet don't treat.
Exactly. Like little, but just that experience, and yeah, I think a lot of people say, well, you had a long journey to get where you wanted to be, but I didn't consider it a journey. It's more, every aspect of it was amazing. Everything I saw, all that went to my education. I did a lot of large animal stuff when I was at Oklahoma and Louisiana. I had to do large animal rotations. Learning how they came to decision making, and having to work on the fly and things like that, and seeing how they work, that went into my education as well. So again, your answer to your question, I really don't know when it all kind of clicked and I felt confident. I think
Are there any cases you walk into and you're like, I mean, you've been doing this for so long now, like,
Yeah.
Oh, I really don't know.
Yeah. Every once in a while, it's a lot less, but and then Wayne and I will, he'll bounce ideas off me, and I'll, he'll show me. It's mostly, hey, can you look at this case? Can you see his gait? What do you think? Does it look, ortho, or so we'll bounce ideas off each other, but most of the time, you know what? Yeah, I don't see a lot of new stuff, and when I do, you know, it's you can kind of figure it out, or you know where to go to look it up. You know, the great thing about having, you know, the internet nowadays is that you can get articles offline. You can, you know, look things up, and you know, the knowledge is there, and just having the experience to say, okay, what do I need to look for? Where do I need to look for it? You know, that comes with time. So.
It does. And that's the hard thing that I think early career veterinarians don't understand as well, is that when we are mentoring, a lot of our decision making is subconscious.
Yes. Oh, yeah.
So we do not know how to answer their questions that they are having of us.
Yes.
I mean, like, hey, why did you do that shot? I don't know. It stops the diarrhea, and I just go with it, you know?
Yeah,
But
yeah,
it's
yeah.
not because I'm trying to be an ass.
No,
I
no.
just don't remember.
This is I've done this for so long. This is how it works. I've seen this so many times. This is, you know, I don't know the mechanism anymore. I'm sorry. Or I maybe I did know it at some point. I don't know. So, you know, I tell the students when they're coming by, it's like, I don't remember all the pathways in, you know, neuroanatomy. You know, I'm a neurologist. I should know all the pathways. I don't. I know what, and I couldn't give you the names of all the pathways. I kind of have some idea, but again, it doesn't matter. It's what you've seen so many times. And so whenever I get students, I do feel like, okay, they're going to ask me about where is this pathway going? I'm like, I don't know. I'm not really sure. But you can always look it up in a book, and all it matters is that you can get a neuroanatomic localization, and you're right. So,
What do you wish early career veterinarians would ask you sooner?
Ask me sooner. In what like in relation to just anything?
Ask sooner, more often. What do you think is the main question a lot of these early career veterinarians are not asking?
Wow. I guess.
Because you made it very clear that they're asking for the 3-day work week.
Oh yeah,
The
yeah.
4-day work week.
I
Like, are there certain things they should be asking sooner in their training or in their thinking they want to go to vet school? Or,
yeah. No,
you know,
I'd say, yeah. Do you want this career? I don't. Maybe. I guess I would, and I would ask them. You know, potentially that this is the right career for them, the right career path. I mean, I think I think that's probably what it is mostly, is that they don't realize what it takes, the commitment and the sacrifice that it takes to be a veterinarian before they get into vet school. They have this idealized version of it, and it can be, but it's a lot of hard work too.
So what do you think the mindset is that separates those that love and flourish in this profession versus those 38% that get out of there within 5 to 10 years?
Yeah.
Because you've been around a lot of students, a lot
Yeah.
of interns, residents,
Yeah.
you've done them yourself.
Yeah.
What is that one mindset that they need to work on to make sure that this profession is as much as you and I love?
Yeah.
Like, because we're both cheerleaders for this
Yeah.
profession.
No, I am definitely. I think that they probably shouldn't blame themselves for everything. They should be able to understand that they're going to make mistakes, and
Perfectionism
exactly.
is not
No,
attainable.
you cannot survive and be a perfectionist in veterinary medicine. You've got animals that are trying to bite you. You got animals, you got things.
You
that
have
are-
clients that are
clients
trying to
bite
bite
you.
you.
You have, things are going to go wrong, and you've got to forgive yourself and understand you're not going to know everything. And I think that's probably the biggest understanding that I had to realized when I became a vet is that I'm going to make mistakes, and those mistakes potentially could cause, cost a life, but understand that, you're still doing this job because there are those amazing cases that, that you can help, and those clients that are incredibly happy and incredibly just happy with you helping them out. And I don't know, the one thing about the profession that I think a lot of people have said, a lot of veterinarians have said this is more about people and dealing with people in our setting than it is about the animals. Being able to, being able to connect with them and help them. I think so many times I get clients saying, "Oh, telling me their life story while I'm taking a look at their animals, or telling me their life's problems or what they've gone through." And you need to listen. You need to listen to them, and you can't be their therapist, but you need to understand that, and that it's all about the people. It's all about helping them. So
every four-legged animal has a two-legged checkbook.
Exactly.
Right?
Exactly.
So if you had an early career vet call you on the phone or
Yeah.
email you or talk to you and said, "Hey, I'm failing at this," what would be the first thing you would tell them?
I would say it gets better, and that I think give it more time, because I do think as you go through the profession, you start to see the benefits of your actions, and then what a positive thing you're providing. And I think even if you're going to have those failures at the beginning, but you just need to give it time, and then and look for those moments, and cherish those moments where you've helped this animal, and in so doing help the owner as well. Yeah.
So what was that one moment that changed everything for you in your career?
That one moment, wow. I would have to say when the realization that I was going to become a neurologist, and that I was going to apply for a residency. I had tried so hard to become a surgeon, and it was, I failed 3 attempts, and then kind of saying, and the third attempt was it was really hard on me. I was like, I really thought I had the residency, and I didn't, and I was totally lost. I didn't know what I was going to do. And then, I called up Mark Kent and, said, "I'm thinking about doing a neurology residency. What do you think?" And I think that was the moment when he said, "You got to go. You got to do it. And do you really like neurology?" And, he kind of went through all of it. And I said, "Yeah, I do. I really think I really want to do this." And he said, "Well, go for it." And then my whole mind switched, and I was like, "Yeah, I'm going to do this." So that was probably it.
Is it okay for a veterinarian to say that they're not going to be everything to everyone?
Yeah. I think you can't. I mean, you gotta say that you can't. Yeah, I think you have to sometimes. I mean, you can't be everything for everybody. You have your own faults. You have your own, emotional issues that you can't necessarily deal with. I think you gotta accept what you can be, and lean into that.
What's one truth about veterinary neurology that you would like every veterinary student, early career vet to know?
that it's not scary, that it is once you get comfortable with doing your neuro exam, and you see a lot of different neurological cases. Again, I know general vets may not see as many and that I do, but once you get comfortable, you'll know exactly what you're dealing with when it comes. So yeah.
I mean, because the one thing that we always deal with is especially on this podcast, is we're trying to help. Everyone uses the word burnout, right?
Yeah.
But by then it's way too late, in my opinion. It's way
True.
too late.
Yeah.
Because the recovery rate from a burned out veterinarian is pretty low.
Yeah.
Like once they're burned out, they're burned out.
Burned out. Yeah.
So, the last question I have for you: what biggest piece of advice could you tell these early career vets to look out for in their own personal self that there might be on that track?
Wow. I guess maybe if you're starting to get angry. I think if you're starting to lash out at the people around you, if you're starting to
have those moments.
Yes. Everybody has periods where you're emotionally you're not gonna, because you're not gonna be yourself. But if those are consistent, and if you're like the staff, or maybe you lash out at an animal, which completely innocent animal, and you start noticing that you're doing that more often. I think that's a sign that you're getting burned out. You need a break, or you need to find another profession. Yeah, I think that.
Well, Dr. Pettigrew, it's been an honor and a pleasure to sit down and have this chat with you. I will have you back again. If any early career veterinarians or veterinary students have any questions or want to get a hold of you, what's the best way to do it?
I'll just go through my hospital, through Blue Pearl Irvine, and they can look it up on the website, and they can go through the neurology department and get a hold of me. Or I'm not sure if my email's on there on the website or not, but
or get a hold of a Western student.
There you go.
They could probably get a hold of
that
for
is
you.
true. That is
but
true.
It was an absolute pleasure talking to you today. If everyone out there has any questions at all, please hit me up, because I'd be more than happy to get people in here who can answer them for you. Again, never, ever, ever, and I'm still honest about it, do I understand veterinary neurology. There's a reason why it is a brain science. And I worked in the profession for, I started in 1990 as a kennel boy, right?
Yeah.
And it still was hard back then. And then I went through school and I did, 27 years of practice, and it was still hard for me. So, going forward, just keep grinding away. Look for those signs that you might be, something's a little off in you. Work on your communication with clients. And also the biggest thing is just remember, you're not going to be everyone's cup of tea. We'll talk to you soon. Goodbye.